Hi, everyone. It's Dr. Paul here. I think we're waiting for Nick. Nick, are you on?
Hi. Yeah, I was on before, and then I guess you weren't on the line yet.
Hi, Dr. Paul.
Hi.
Hello.
Hi, everyone. Nick, are you ready to go?
Yeah. So welcome everyone to the press briefing about COVID-19. We're going to give you Dr. Paul is here to give you another update today, and then we'll open the floor to questions. Bienvenue au point de presse du bureau de santé du bureau à propos de COVID-19. Dr. Paul va faire sa mise à jour sur le COVID-19 et ensuite vous pouvez poser vos questions. Dr. Paul, good to go.
Great. Thank you very much, everybody. Merci beaucoup. It's going to start really, there's not much really new to report in terms of any other activity locally. I can tell you that we've had some questions and I'll answer them, but I'll just give you an overview of our assessment centers. I've asked people to mute their phone while we're on the call too. Let me start. Actually, some of the updates are related to some of the questions that I've got here. So I got a question from Philip. Can you put your phones on mute, please? I got a question here from from Morris Leader. Can we release the geographical locations of the testing centers? I just want to say that, especially what we'll be doing, we're going to be doing between 5 and 6, and the centers are going to be in the Hawkesbury area, in the Cornwall area, in the Alexandria area, in the Winchester area. And they're likely going to be a couple more in the Prescott Russell area because it's such a big area there. The reason I'm not being clear is because we're in the process of setting them up. They could be running as soon as very early next week, depending on where it is. And again, the direction that we've had for these centers is really the combination of looking at emergency room decongestion. So each of these, the hospital, we have 4 hospitals, and so basically what we're doing is essentially we're going to be having each hospital have its sort of offload system. So that's why we're strategically located in those areas. We also will be having our EMS partners, paramedics, are actually going to be going when we require somebody to be tested, and we'll be sending them to their home to be doing the testing, and that's going to be a big help for us across our areas, and that's going to be implemented very, very shortly. The other question is I said that I had about 60 tests. About how many tests have we done? At this point, we're still around that number. I would say a bit more. We don't get the number of tests done because each hospital does it separately. We get the results, so I can try to keep a number updated for everybody. The other question, c'est Denis Bevin qui a envoyé la prochaine question. C'est une question que je viens de demander et en discuter avec le ministère. Évidemment, on appelle ça personal service centers, les centres pour les services personnels, soit les esthétistes, les coiffeuses, etc. Et à un moment donné, moi je pense que on est en train de voir la direction du ministère, mais à mon avis, à un moment donné, on va les ordonner de fermer aussi, parce que je pense pas qu'on pourrait vraiment prendre le distance sociale. The question here is one that I've actually been in negotiations with the ministry now, having to do with personal service settings. This was asked from Radio-Canada, but I think it's important for others to know. Personal service settings like barbers and hairdressers and tattoo parlors, by virtue of the nature of what they're doing, there is close contact. So we're looking at provincial direction for that. I think that we will be going towards closing them, and again, this is going to happen shortly as soon as we have a sort of a direction for the ministry, and that for that one. I have another one from Nation Valley News, which is if somebody is self-isolating and tests negative, will they receive a courtesy call? Yes, obviously, anybody who tests, they will get a call from us, whether it's positive or negative. And depending on the situation, they will be advised to remain or leave isolation. I have another question here on, a lot of readers are asking if they must self-isolate after shopping in Messina? Boy, that's a good question. Technically, if you go to New York and if there's a hot spot, yes, technically you should be self-isolating. Again, it depends on the context of where you are. I mean, if you go somewhere you don't have a lot of contact with a lot of people and you keep a distance, you're probably safe. But it's hard for me to say because I do recognize that in general we're saying if you travel abroad, and this is something that we're dealing with Akosasni. A lot of people work in Quebec, or the Quebec side or Ontario side and live in New York and vice versa. So those are challenging for us at this point. But I would recommend not crossing the U.S. border because at some point they're going to be limiting. I don't know if you've heard, both governments, Ontario, Canadian and federal, our federal government and the U.S. government are actually looking at stopping all non-essential crossings at the Canadian-U.S. border. So that question is going to become irrelevant at some point. Then I have another one. I understand that at least one local bar was open last night for St. Patrick's Day. What is your message to businesses for defying the provincial order to close? Well, I can tell you that because it is a provincial direction, this is going to be enforced by police. This is an enforcement by police, and so individuals who defy these orders can face prosecution and so on through the police. And this has been done. Actually, we got a memo from the Ontario Chiefs Association giving that the clarity because this is a provincial order. And these closures have been done based on a widespread, Ontario-wide provincial emergency declaration. So it then becomes an enforcement issue with police. And that's the questions that I've had. In terms of our next steps and how we're planning, again, we're always going to be looking at trying to identify areas where we can have an opportunity to, again, still share the social distancing message, looking at, again, our numbers, looking at signs that we have local transmission, which still we do not have, and again, looking at making sure that people understand that even though we don't have, full-blown infections, looking ahead and looking behind us, actually. As a matter of fact, this morning I read that, when this thing started, we were looking at, China has 10,000 cases, 20,000 cases. They were going up and up and up, to the point where it reached like 75, 80,000 cases. And out of like 90,000 cases, 85,000 cases or whatever were in China. Today I found out that there's almost the same number of cases in Europe that there were in China. So Europe is becoming a big hotspot, and so we're learning from that, and it really goes very quickly because this seems to be spreading in that way, and so we're trying to say to ourselves, listen, we're going to try to get ahead of that curve, ahead of that sort of big influx of infection by these measures. And I've said time and time again that we have measures that we can impose. We've imposed a lot of them already, but we could look at further imposing measures, like, for example, perhaps diminishing at some point, like they've done in the United States in certain areas where now we say 50 people or less can congregate, whereas, some states are saying 10 or less. So these are all scenarios that, for a lot of you that came to the media update that I gave, we have in our armamentarium of being able to move forward. Again, all of this is to be able to stave off significant numbers and decrease that peak of that curve. So that's all I have to say right now. I think I've answered some of the questions, and we'll take a couple more questions before I need to go on another teleconference.
Dr. Ball, just a follow-up, Bill Kingston, Corval News Watch, just a follow-up to the bar. You said the provincial orders being enforced by police. Outside of that, I take it that means that the health unit can't enforce any sort of reprimands or anything against an establishment that defies the order?
Well, this order is under a different type of emergency management. Yes, if for example, we see a food violation or something that's under our jurisdiction, we can do it.
I'm going to ask him a question.
but we can't. We need to. And the thing is, Bill, we got clarity on this just like about 15, 20 minutes ago. So I presume that this is a police because it's a civil matter. So, but we have been getting some complaints about restaurants, and we will be looking at what they're doing, and we've actually just got a sort of guidance of how they can safely prepare food for takeout and so on. That'll be more of our role. But again, in terms of the order being broken, it is a provincial enforcement issue.
And let me just finish this. And if the police are enforcing the order, if they don't do anything, are you worried that that's going to set an example that this is not being taken seriously if the police don't fine or don't reprimand the people?
Definitely I am, and this is why I'll be speaking to our police partners to see what the actions are going to be, even retrospectively, or at least some kind of a warning or something like that. Yeah, we're not. I'm actively. As a matter of fact, I have a call with the local Cornwall chief today, and I'll speak to the OPP as well, because I want to have sort of a consensus of at least making sure that we mean business when we do this. Like, this is serious.
Okay. And Dr. Paul, Nick Seabrook, Cornwall Seaway News, I was wondering if you could expand a little on what you just talked about with paramedics going to people's homes to test. When would that come into effect? Is that possible to do now? How does someone go about getting a test at their home?
What happens is when we get somebody calls us and we ascertain that they need a test, we have two choices. Either we send them to the nearest emergency room, or in the future send them to an assessment or a testing center. Or now we have a choice of sending the paramedics to their home. So the paramedics have been trained to do that. I've given them medical directives to do that in both SDNG and Prescott Russell, and they should be starting that imminently. We're talking a day or so. So that would be available. And like I said, we're getting up to 400 or 500 calls a day now. A lot of them don't need screening, but if they do, either we send them to emergency, but now we have another choice. As a matter of fact, our EMS partners, our paramedics, will also be helping us in our assessment centers as part of their community paramedic system as well. So we welcome their help, and I'm very happy they're there to help us.